Yeah, so I'm Professor Kiran Patel, Chief Medical Officer and Deputy Chief Executive and cardiologist at University Hospitals Coventry and Warwickshire, and also Chair of the South Asian Health Foundation. Yeah, so we were talking this morning about how primary care networks can help reduce health inequality. And my points were really around making sure that we have data and dashboards that are robust enough to tell us what our patients look like in terms of profiling, but couple that to the interventions, which are based on good evidence-based research about what we should be doing so that we can deliver services to drive down those inequalities. And I talked a little bit about we, as workers in the NHS, being the advocates for our patients and populations and knowing how to influence all the way from national policy level down to local delivery level at a grassroots. So I gave some examples of inequalities. So, for example, I talked about Bangladeshi women having heart attacks and the fact that actually, unless we realize that chewing tobacco is a risk factor in those women, we can't produce interventions to reduce those rates of tobacco chewing at a population level to reduce the incidence of myocardial infarction for those women. So there are many, many examples and data sets out there. Another one is diabetes prevalence. We know it is 4 times as common in South Asian populations, and therefore our screening programs probably need to be targeting South Asian populations, but also starting 10 years earlier so that we detect it early and we couple interventions. So there is a huge evidence base out there. What we need to do is to have it synthesized and tailored for the primary care networks around the country. And there are initiatives and there are platforms out there which tell us about all this data, but actually we need to turn that data into intelligence at a local level for PCN. So I think there is a lot of work to do in order to enable that. So the APNA conference is great because we have some really passionate individuals who form the backbone of many of our services. And if they take away key messages and implement them locally, then we've started a social movement for change out there across the NHS.